Hi, everyone. My name is John Faulkner, and I'm the host of the Smarter Systems, Better Care podcast. I'm here today with Stone Bodini. He is the co-founder of Keeper. This is an innovative platform making healthcare price transparency a reality for providers and patients alike. Thank you for joining us today, Stone.
Hey, John, thanks for having me. Excited to talk today to talk about the direction of healthcare and how we see it changing in the future.
Absolutely. Just to kind of get us started, too, do you mind telling us a bit about your background, your business model, and the clients that you serve?
Yeah. So background was previously worked at an MSO in healthcare, and a lot of the companies that we were going to work with and helping serve, a lot of them had the same issue of their contracts, their payer contracts with insurances were either very old and about to expire, or very old and hadn't been reworked in 10 to 15 years, or they'd just been reworked, but they were giving subpar rates. Fortunately, there is an executive order called the Price Transparency Act in healthcare, where all insurance or payers have to put out their negotiated rates with every single provider or anybody who holds an NPI that they have a negotiated rate with. We're working on, aggregating that data and giving it to the people.
Excellent. And then, what's the core focus of your business today? And, what role are you playing in driving that growth? Because I think before we had talked, you're working with someone else, and it's kind of how you're working right now.
Correct. Yep. We have a co-founder. We'd been best friends since second grade. We were two kids that always talked about, wanting to start our own business together. And this is just the niche that we found that we thought we could solve it a little better than everybody else doing it on the market. He is definitely a lot of the tech side for solving this problem. He has a great pedigree and works extremely hard all hours of the night trying to aggregate the data together. I'm sorry, I didn't answer. Can you re-ask that question?
Yeah, no problem. Just
Yeah.
kind of what's the core focus of what you guys are working on today, the role you're playing in driving that growth? You kind of talked about with your partners, you get more of the technical side that he's working on. And then what are you working on, the business side?
Yeah. So business side of it is we've got to get this in the hands of as many ambulatory surgical centers, billing companies, or primary care physicians as possible.
Yeah.
What's shocking to us is a lot of people, when they hear that their negotiated rates are out on the open web or free for everybody to go look at, a lot of times they think there's no way. I signed an NDA when we went ahead and got these rates. There's no way that you have them. And then what we'll do is we'll just show you a couple of your guys' rates. And it really opens people's eyes up to, if my rates are out there, then everyone's rates have to be out there. How am I stacking up to the market, which is something that no one's known before.
That's amazing. And then I think you're going through some pilots right now, right?
Correct. Yes. So we're going through 3 pilots right now, one with an ambulatory surgical center, one with a medical billing company who's, billing from anywhere from primary care physicians to skilled nursing facilities to multi-specialty groups. And then a third one is a pain management center.
Excellent. What's some of the feedback that you're getting from people, just out of curiosity?
The biggest one is that shock or wow factor, honestly, when they're first on the platform because a lot of these organizations and anyone in healthcare might even know this, a lot of people don't know their fee schedules. So they'll have a general idea of what we should be getting paid for each procedure by each payer, but they don't have it down to the cent. And that's what we show you immediately. We have to build trust in our platform. So we show you your fee schedule without you even needing to go find it or dig or have that conversation with insurance for months. We'll show it to you, and then we can show you everyone in your surrounding market, all your competitors as well.
That's interesting. So they may not even know their own fee schedules, you're saying, potentially down to a very precise number. So you give them insight on giving them really clear data so they can make decisions, I'm sure, on what to do next, right?
Correct. So some organizations that we've worked with, they haven't negotiated contracts in 10 to 15 years. They've just kind of been going through the motions. They've really been focused on growing their patient base, but a very easy way to increase revenue. I shouldn't say easy.
Yeah.
Contract negotiations can sometimes take, 6
forever.
to 12 months. Yeah. But a simpler way to increase your revenue is if you can just increase your bottom line on what you're getting paid on all those procedures, you don't have to change your patient mix or patient volume. You can just start getting paid more than what you're already doing.
Yeah. Think you don't have to change anything, just get paid for what you're doing and properly in the right amounts.
Correct. Yeah.
Yeah, absolutely. And if you had to state your competitive edge in 30 seconds, what would you say to a potential prospect or someone that you may be working with?
Yeah. Our competitive edge is definitely the speed that we can pull together many insurances or many CPT codes or procedure codes. A lot of the other competitors on the market, you have to go in, one NPI at a time or one provider at a time and one CPT code and compare a single code at a time. But as anyone working in the space knows, you're not only seeing patients for one procedure. Your majority of yeah, your volume is probably comprised of, 10 to 50 procedures sometimes. We let you batch it together and see it in a group very quickly. Within, less than 5 minutes, we'll go ahead and get you all of your competitors' rates just in front of you.
That's amazing. So it's saving them time, saving them money. And it sounds like it's very easy to use. It's very intuitive. Like it's not too complicated to interface with on a daily basis. They need to.
Yeah, we want to hide as much of the data processing as possible, because a lot of these CFOs or revenue managers or payer contract specialists, they're used to Excel, which is great. But yeah, we don't want to throw a ton of code their way and show them how we're processing the data. We just want them to be able to say, here are the providers we want to look at. Here's all their procedures. Just show me all of them in an easy, digestible format.
That's amazing. That's what they need to, because they don't have time to get lost in the weeds and things. So that's a really good approach to have in that process. And then like with this that you're working on, like what's one shift in the industry that you think most founder operators are basically underestimating at this time? Like what are they not really thinking about? Is there anything that comes to mind?
Yeah, I mean, AI has certainly shaken up a lot of things in the startup space and the medical space. And the medical space is often lagging in terms of tech. I mean, we see it in healthcare. There's 100 different EHRs that people can be on, or EMR systems that people could be on. So as soon as a patient goes from one hospital to the next, it's kind of a mess to get all even their patient records together. But in the startup space, with tech and AI enabling so much, I think a lot of startups are going to pop up very quickly with an MVP a lot faster than the people are ready for in the tech and in the medicine space. And that's just, great for competition, fuels the market. Maybe some of these big dogs can get knocked off their pedestal, and some cheaper and even better options can come into play.
Yeah, like a competition will really, it's definitely heating up for sure. I'm seeing that as well. So that's good to see, kind of being powered daily every time. You can even see it on LinkedIn. It seems like there's a new company I've never seen before every single day. Even by the hour, it seems like sometimes they're constantly being created. So, and then like, how are like you adapting to like this trend of like AI, and like, how is that affecting your business?
Correct. So for these payer negotiations, we'd love to incorporate AI in one way or another. We have a couple things on the back end for analyzing the data that's definitely machine learning driven. I studied machine learning at UC San Diego, and then my co-founder has a master's degree in computer vision, again from UC San Diego, and he worked at Google, did everything for them.
Nice.
There's definitely ways we can see it improving the workflow, but we thought we were just going to come in gun ho, jump the gun, be all AI right away. But we've really quickly realized that this is a very educational problem of, we need to educate the market and make sure that everybody knows this data is out there. It's usable. There's going to be, truthfully, a couple organizations probably that take massive advantage of it. And then everyone else might just be left in the dust.
Yeah. Yeah, that's a good point. It's more of it's a lot of an education thing to show them the value of why they need your product, right? That's like the biggest part, it sounds like, because like you said, you might have someone using an Excel document and this is like a new fancy thing to them, informational probably, because they're just so used to that process they've used for so long. But you can show them like the straight and narrow path of how to make it easier for them in the long haul.
Yeah,
Absolutely.
getting people off Excels, and you can collaborate on our tool, kind of like a Google Drive, so you can see what your whole team's doing live.
Oh, that's amazing.
It makes the workflow a lot easier, especially, like I said, during these contract negotiations, where sometimes the analysis prior to entering negotiation, some teams will spend a couple months doing it, but we just want to get it to you quickly so you can start that negotiation fast.
Yeah, absolutely. And then like, kind of talk about like AI affecting your business. What do you see your peers doing with it? I'm just kind of curious if they are they more focused on the AI as a solution, or are they more like you working on the education piece?
So in terms of AI, where I see most peers using it in the medical space is definitely still just using ChatGPT, kind of like a Google. I think a lot of people are afraid of, AI is going to come take our jobs. I think we're a long way away from that.
Yeah.
People just recently figured out the appropriate way to Google for things and find information.
Yes.
And it's going to be the same timeline for AI. We're not going to wake up in a year, 2 years, and everyone's an AI wizard. I think everyone's just going to start transitioning and using it as their Google.
Yep.
And then the people that, the top 20% of each industry, those are the people that are going to really lean into it and really leverage using AI to just increase their workflows.
Yeah. It makes them almost like super employees or super founders. It definitely, I'm sure, generates ideas pretty quickly and gets you thinking about things from a different perspective, or many perspectives too.
Yeah, it lets us wear many hats very quickly. For example, neither of us have sales or marketing, but it's certainly given us ideas or drummed up some campaigns that we might run with
Yeah.
it that we wouldn't have thought of without it.
Yeah, that's amazing. And then like, are there any pain points in your operations today that you guys are working through? Things like bottlenecks or places where you're stuck?
I mean, of course, that's the nature of a startup, right? There's
Yeah.
always a hurdle to tackle.
Yeah.
And the most daunting one is always the hurdle nobody wants to look at, but it's what would give you the most headway, and accomplishing your goals. Right now, it's definitely sales. Our tech's there. We have all the major payers on the platform. It works. We've stress tested it with about 20 users on the site, which doesn't seem like much, but there's not going to be that many organizations doing a contract negotiation at once.
Yeah.
And we're able to show you all of your competitors in the market. Like I said, under 5 minutes, it works. So now it's just sales, getting the word out there. And right now, nobody knows we exist. So it's worth it to post every day and email every day still.
Yeah, that's why when I saw you guys, I'm like, I've never heard of this, but it sounds like an amazing solution, you know? Like you said, you just got to get the word out and get people to hear about it. And then once they talk to you and see it, I'm sure in action and like a demo, things start to click.
Yeah. Warm leads have been fantastic. Everyone that's used it and shared the word's been great. But yeah, cold outreach is just obviously hard. And like we've talked about, medical is an old and slow to adapt field. So a lot of people's mindsets like, if it's not broken, why fix it?
Yeah, absolutely. And then like, are there any parts of your workflow, like the sales intake, marketing, that you wish just kind of ran smoother? And then I'm sure that goes along with like the umbrella of sales. I'm just curious.
Yeah, I mean, obviously, if sales goes smoother, your conversion rate goes up, you'll get paid faster, right? So
Yeah,
that's obviously something that would be incredibly helpful for our startups because it's the lifeline of a business. So yeah, probably just the sales process, getting people any warm inbound leads would be great because
yeah,
right now it's just a lot of outbound.
yeah, absolutely. A lot of time spent there is like the founder being the salesperson, multiple hats, that sort of thing. It sounds like so.
Yeah, everyone jumps. We all jump in. We're all sending
Yeah,
emails every day because you have to. Who else is going to do it? There's nobody else on your team besides us.
yeah, absolutely. And then as far as like what's working really well right now, and then like what's been harder than expected throughout this process, like something you maybe, I know hindsight's 2020, but like what's something that's been harder than you just never anticipated?
Yeah, something that's working extremely well is the workflow we have on the IT side. So we have like Monday, let's process data. Monday, Tuesday, Wednesday, let's process data and make sure it's all working. Thursday is when we have like, quote unquote, all hands, even though it's just us two, but that's going through the platform, seeing what users' feedback was throughout the week. And then on Friday, let's just fix everything or improve anything that we've gotten feedback on. And sticking to that schedule has just made sure we can stay focused on the core mission of processing this data and getting it in the hands of as many people as possible, but also iterating on things we've built in the past. And maybe it's something we've built, 6 months ago and we've kind of started to overlook it. But then someone on the platform goes and says, oh, maybe it could work a little better this way.
Oh yeah, it sounds like you had a really good iterative process of like an agile process. Like you work for 4 or 5 days to get feedback, make adjustments, and then you keep just making it better, which is
Yeah.
great. So
Yeah, we got to go fast. I think one of every startup has the competitive advantage of your team is small and the clients you're only serving so many clients. So that customer is number one. Every single customer is literally number one in your eyes. It's not like
yeah,
there's some enterprise customers and small, medium market customers. It's everybody matters a ton to the business. So anytime someone gives feedback, we'll always consider it and always take it into account and typically immediately get back to them of like, hey, this is why we can't do this, or yes, this is a great idea. We'll do it this weekend.
yeah, yeah, that's amazing. And are there like metrics in your operations too, like things you look at from week to week, like, hey, this is not really moving the needle, or like, hey, we really need to adjust and work on this like next week, or there's things like that that put your data analyst hat on that you observe?
We typically right now it's how the outbound's going. Like we're doing a lot of A/B testing with
Yeah,
emails and calls. We're going out and seeing what's working there. But at the end of the day, sales is a pretty big number game. It's how many phones do you hit, how many emails you send, and one or two of them are going to hit eventually.
yeah, absolutely. Especially in this market, you don't need a million, you just need a good handful to start working from. So
Correct.
absolutely.
Yeah.
Um, And let's say you solve the big blockers. Like, what does success look like in 6 to 12 months? Because I know you're still early. Where do you want to be in 6 to 12 months?
Man, 6 to 12 months. I feel like we pivot every single week,
Yeah,
right? With how our conversations go in the startup
it's probably hard to
space.
think about sometimes, but yeah,
Yeah, I'm thinking about next week. Like, what are we going to be doing?
Yeah.
6 to 12 months. I'd love to have, a a large client in the books in terms of a very large billing company, a very large surgical center, um, or a hospital at that. That's a long ways out. We're still going to work on getting towards there each day. There's a lot of baby steps on the way, but that's the dream. Like really nail down a large client who we can help serve a lot of people and just make sure they're getting paid well, because at the end of the day, medical expenses are going up, labor's going up, and a lot of these insurance companies don't want to pass any of these savings or any of the profit they've had throughout the years onto the organizations. And if they don't pass them on to the organizations, the private equity is going to go and buy a lot of them up and just bundle them up and give less of care to the American people, which is what we're trying to have avoid. We want to help primary care physicians or private practices stay open and stay independent.
Yeah, that's a good point. Is like I'm sure you've heard about all the mergers and acquisitions going on, and like these private practices are scrambling for solutions to stay alive in a sense. Like, they're literally the patient on the table trying to resuscitate them, unfortunately, because maybe they haven't adopted new processes, or maybe they can't figure out how to attract more patients or that sort of thing. And this is like a solution that can help them kind of reap what they're already doing and help their bottom line to keep them afloat, you know.
Yeah, there's no majority of people's rates for all these payer contracts. They're not keeping up with inflation, and you need to be renegotiating. You need to probably look into renegotiating every contract every year,
Yeah.
but a good benchmark is you should be renegotiating all your major payer contracts every 3 years. And a lot of people will go, the 8, 10, 15, 20 years without
Long.
renegotiating.
Yeah.
Yeah, it just gets to the point where even when you do enter a renegotiation, you have to go in and ask for a 200% increase on your
Wow.
old rates.
Yeah.
And the insurance company makes you feel like you're being ridiculous. They're like, well,
Yeah.
why, how are we supposed to double your rates? This is absurd. And you would just have to take them at their word for it before. But now you can say, I know that this is what every other similar specialty with the same number of providers in our areas getting paid, doing the same procedures. I'm not entitled, but I deserve the right to fight to get these competitive rates.
Yeah, absolutely. And like you provide the platform for this basically basis of the argument. Do you help the client with the argument too? Is that part of what you offer?
Yeah, we would certainly come in on the service side of it. The last thing we want to do is have a primary care physician pay for the product and we just say, hey, good luck.
Figure it out.
Like,
Yeah.
now go get better rates. Yeah, that's the last thing we
Yeah.
want to do. With all the pilots we've been working on so far, we're in that negotiation process with them. Because not only is it helping us learn a lot about it and their specific case, but we're the data guys. We're the very heavy tech data guys. We're pretty good at forming an argument on behalf of the provider or the organization to the insurance company.
Yeah, because that's the language the payers speak is data. They can't argue with the data if this is what it shows. Very specifically, like here's Dr. Smith 1 mile away from me, the exact same specialty or subspecialty. There's not a whole lot to argue there.
Yeah, no, it's a cat and mouse game for sure
Yeah.
with the payer, because you know, like they're not going to give you exactly what they want.
Exactly.
But yeah, you just got to back them into the corner as much as possible.
Yeah, absolutely. And then like thinking more immediately, we kind of looked down the road. Like, is there something you need to know, like to figure out soon in your operations, but haven't had time to tackle yet? Does anything come to mind?
So I spoke on earlier about the Price Transparency Act being the, executive order that's making this data available. There are definitely insurance companies that we have run into that are making this data purposely very difficult to read and understand.
Yeah.
Which, I mean, that's why we're a startup. That's the problem we're trying to solve, right? But there's a couple of insurance companies, Humana being the main one, where any company you talk to that's serving MRF or price transparency data, they'll tell you straight up, we do not have the Humana data. It's so large and so egregious that it's unusable. You cannot process it with with reasonable, expenses. So something that should be tackled in the immediate is people just need to speak up and talk about these insurance companies that we don't have their data. Why don't we have them? And how are they able to, be out of compliance for years on end and have no recourse taken against them?
Yeah, that's interesting. So there's like specific companies, it sounds like, where they may have the data, but they just give it to you maybe as like a big text file or something, like figure it out.
They're all giving it to you in these terrible files called JSON files. Every single one of them is given to you, and they're massive. There's more. Everyone knows Netflix. There's a ton of movies on Netflix. There's more data in the price transparency. There's more in terms of size. There's more terabytes of data in this price transparency data than there is on the entire Netflix catalog of movies.
Wow. That's
There's
crazy.
I know it's every provider in the nation, but it's still, there's no way it needs to be that much. There's so much duplicated data. There's so much just, fake dummy data that you have to scrub through and clean up, or else it'd ruin your analysis. That the pairs are purposely making it difficult.
Yeah, that's really frustrating to deal with. And really appreciate your time today, kind of diving into this, uh, a very innovative solution to a lot of providers' problems that they're having today. They might not even know, they may be thinking about this, but may not know there's a solution out there. So I appreciate your time and sharing that with the audience today. Where can people find you now that we're trying to get the word out and about what you're doing? Where can they locate you online?
Yeah. I mean, our website's live, keeperhealth.com, or feel free to email me at stonebodini@keeperhealth.com.
Excellent. Well, thank you for your time on the podcast and have a wonderful day.
Yeah, John, I appreciate it. Have a good one, man.
Thank you.